And the BRICS Summit, a gathering of Brazil, Russia, India, China and South Africa, is due to take place later this month in Johannesburg. But already plenty of meetings ahead of that event. And this week, health ministers from the 5 nations have been meeting in Durban. They're due to sign a declaration tomorrow. And to tell us more, I'm joined by our Health Minister, Dr. Joe Paahla. Doctor, thank you so much for joining us. So I know that there were a number of issues raised, but of course I'm going to start immediately with the discussion you had around infectious diseases. There was a lot of discussion around how to make sure that you've got readiness plans in place. Lots of lessons, I'm sure, from COVID. Given that COVID, of course, began in China, I would have imagined that the health minister from China had so much to input. What did you learn about COVID from China during the meeting this week?
Thank you very much, Sally. Maybe just to make a correction that's far, the people who have been meeting is our senior officials over the last 2 days. And then tomorrow, in fact, the ministers have started arriving. So in the next hour, I'll be hosting them for just a reception, and then we'll start with the detailed discussions tomorrow. But we already had the feedback from the senior officials who have been meeting, a number of areas which they've been looking at, including the fact that, as you have said, of course, you know, our emphasis in discussing these issues is not in terms of where COVID started. I mean, it is important in terms of experience, because we learn a lot from each other. But what we are focusing more on is in terms of the lessons to learn from each other, the ways in which we all intervened in terms of mitigating against the impact, and the tools which we used, and the shortcomings, and then the experiences sharing those common experiences, and then working on a way forward in terms of how to be better. And one of the things which we will be looking at, which has been proposed and worked on by the senior officials, is what is called an early warning system, to make sure that the 5 countries can improve working together in early warning systems, learning from the COVID. And we are informed by all the scientists that there is going to be future pandemics as well. So the early warning system is one of those, but also an area which is also called a network for public health emergency preparedness, the operation centers, which our 5 countries will also be cooperating. That's just in the area which you were asking about, in the area of COVID-19.
I mean, and you know, I think it's such an important meeting to have, because nations from the Southern Hemisphere, let's face it, were not as prepared, it seems, as nations in the Northern Hemisphere. And there was a lot of cooperation, a lot of getting together, and very often we were sort of just picking up from them. So I think it is crucial that nations such as ours really take the lead. So that's an important discussion. As you say, you're going to speak to the health ministers tomorrow, but meetings have been happening. Nuclear medicine on cancer, which is a great field. I know that South Africa's involved in that. But also you're talking about a BRICS TB network. Now, if I'm not mistaken, South Africa has the highest rate of TB, or one of the highest rates of TB, but I think India has as well. So there must be a lot that you can share in terms of information. Talk to me about how a network like that would be mutually beneficial.
Well, firstly, you are correct that as South Africa, we are the highest burdened country in terms of TB. But because of the other, countries are bigger than South Africa, as you would remember that India and China are both population over 1 billion people. Of course, Brazil also quite big, and Russia. But in terms of TB burden, we are the highest burdened. India has got quite a significant burden of tuberculosis. Also Russia, China, and Brazil to a lesser extent. So the network on TB research is already working, and this network is more to improve. And we also will be proposing in the meeting tomorrow that we will host also a 2-day conference of researchers and experts later this year. Now, this network is basically looking at new diagnostic tools. We know already that there's quite an advancement in diagnostic tools, but we're still missing over 1 million TB people with possible TB. So diagnostics, new treatments, improvement, because we want to keep further improvement in terms of kind of treatments which can last shorter rather than the 6 months and the 9 months for the drug-resistant TB. But also, more importantly, also major research in vaccines, vaccines which can prevent tuberculosis. So these are the areas in which our senior officials will be presenting proposals. And as I've said already, we're looking at following this meeting of this week with an assembly or a conference of senior researchers from the 5 countries to look at further advancements hosted by our Medical Research Council.
Yeah, I mean, it seems there's a lot of learning that can be shared. Tomorrow there's a declaration, a health declaration that's going to be signed. What exactly is in that declaration?
Well, in that declaration, topmost will be the issue of pledging to work together in realizing universal health coverage. We know that, I mean, in our country, what we have put forward, I know there's a lot of debate around national health insurance, but at the end of the day, the bottom line of this is to achieve universal health coverage, making sure that we can share in experiences as we will be talking. You know that, as I've already mentioned, these are countries with huge populations, almost, I think, just around 1/3 of the world population. So there's a lot on universal health coverage. To what we are pledging here is to share experiences in terms of what each country is doing, because this is a United Nations pledge for all of us under the UN and the WHO. Later next month, heads of state will be gathering in New York, amongst others, to report back on what has been done to achieve universal health coverage. So this will be quite an overarching theme in our discussion in the pledge. And then all the other issues, pandemic preparedness and prevention will be there. The issue of cooperation in regulation of medical products and technologies. These are some of the issues on which we'll also be pledging to work together within that declaration.
It's absolutely fascinating. I mean, of course, India, let's not forget, is a massive producer of vaccines. So there is a great deal to learn from these BRICS countries. Thank you so much for telling us all about it. That, of course, is our Health Minister, Dr. Joe Paahla. Now, it's still to come